So you're gearing up for a board exam. And let's be real, it isn't just a test of what you know. It's a test of endurance, of strategy, and of your own mental game. That's why today we're not just going to review facts. Nope. We are going to build a strategic toolkit, one designed to completely transform how you take on and conquer these massive exams. And if you're looking at this and thinking, yes, that's me, let me just say, that is 100% normal. I mean, the sheer volume of information feels like a tidal wave, right? The pressure is just immense, and it feels like every single question is designed to trick you. It is so easy to feel like you're just trying to keep your head above water. And here's why. Because just memorizing all the pathways and the latest protocols, it's never going to be enough. The people who get the highest scores, they don't just know more stuff. They actually think differently. They have a system. And today, that's exactly what we're going to build for you, your very own strategic toolkit for exam day. So our toolkit is going to have 4 key pieces. First, we are decoding biostatistics. Then, we'll learn how to navigate those tricky clinical vignettes. Third, and this one's huge, we'll focus on building a winning mindset. And finally, we'll wrap it all up with your strategic takeaway. Okay, first up, biostatistics. I know. For a lot of people, this is the part of the exam you dread the most. But let's try to reframe it. I want you to think of biostats as your analytical lens. It's a tool that lets you cut right through all the noise and see the data for what it really is, with total clarity. And it all starts right here, the null hypothesis. Before you can prove a new drug or treatment works, you have to start from the default position, which is that it doesn't. The null hypothesis is simply that baseline of no effect. So the whole point of a research study is to find enough evidence to say, you know what, we can confidently throw out that starting assumption. Keep that in mind anytime you see a study on your exam. Now, let's talk about the 2 ways you can mess up. A type 1 error, that's a false positive. You get excited and say there's an effect when, whoops, there actually isn't one. A huge trigger for this on an exam question, they'll mention a study that was stopped early because the results looked so good. Red flag. A type 2 error is the opposite, a false negative. You miss an effect that was really there. This usually happens when a study is too small. So on the exam, the fix is often something like changing the protocol to, say, increase the number of people in the study. All right, let's do a quick pop quiz, a classic exam scenario. You get a question with a confidence interval for a relative risk or an odds ratio, and the range crosses the number 1. Let's say it's something like 0.8 to 1.3. What does that tell you? Instantly. Bam! It means the result is not statistically significant. That's it. If the range of possibilities includes the number 1, it means there might be no effect at all. No increased risk, no decreased risk. The study, simply put, failed to prove a difference. This is such a quick and easy point to score on exam day if you just lock in this rule. Let's do a quick lightning round of a few other principles you are absolutely going to see. First, blinding. That's when patients or doctors don't know who's getting what. It boosts a study's internal validity, making you trust the results more. Next, watch out for really tight sampling. If the study group is super specific, it can limit the external validity, meaning you can't really apply the results to the general population. Also, keep an eye out for susceptibility bias. That's a sneaky one where sicker patients might end up in one group more than the other. And finally, just remember that matching is a tool used to control for those annoying confounding variables. Okay, tool number 2. Let's grab our clinical compass. This is going to be your guide for tackling those super long, super intimidating clinical vignettes. You know, the ones that feel like they're a mile long. Okay, this is a game changer. I want you to stop reading those vignettes from top to bottom. Just stop. It's a terrible way to do it, it wastes time, and it's designed to confuse you. Instead, you're going to use the bottom-up strategy. First, you read the actual question at the very end, and you glance at the answer choices. This immediately frames what you're looking for. Then you go straight to the hard data, the labs, the physical exam. Only then do you skim the story at the top to pick up any key context. This will save you so much time and helps you cut right to the chase. Here is a golden rule, a mantra really, for when you're stuck between 2 different ways to manage a patient. If you are ever unsure, always pick the non-invasive or the least invasive option first. The exam isn't just testing your knowledge, it's testing your grasp of patient safety and clinical workflow. Unless it's a code blue emergency, you do not jump straight to the most aggressive thing. And that leads us perfectly to another absolute gem of a principle, especially for those tough ethics questions. Any answer choice that involves facilitating a discussion or clarifying a patient's goals of care or exploring what they want, it's almost always the right answer. The exam heavily prioritizes patient-centered communication. So you want to look for the answers where you are empowering the patient to make a choice, not making the choice for them.
But there is one major exception, and that's in acute surgical situations. When a patient is clearly circling the drain, the rules change. Passive answers like await labs, or observe, or schedule a follow-up, they become the wrong answers. These questions are testing one thing. Can you recognize an emergency and act decisively?
All right, we've got our analytical lens, we've got our clinical compass, but you know what? Neither of those tools will matter if your head isn't in the game. That brings us to the final and maybe most important piece of our toolkit, the resilient mind. This is all about the psychology of test taking, about controlling your headspace when you're under extreme pressure.
The moment you feel that panic start to bubble up, I want you to remember this. Your brain is getting overloaded, and fear just clouds your judgment. So take a breath and simplify the question down to its absolute simplest core. What are they really asking me here? Because fear is the absolute enemy of clarity, and simplicity is how you fight back.
So what do you do in that dreaded moment when you read the answer choices and none of them feel right? That horrible sinking feeling. Your instinct is to panic, right? To just close your eyes and pick one. Don't do it. The strategy is this. Go back and reread the very last sentence of the question one more time. You probably missed one tiny key word. Then your job is to find the least wrong answer. The one that, even if it's not perfect, best addresses the main problem. Oh, and exam writers, they love to do this. They'll create these bizarre cases to throw you off your game. They'll present a totally classic disease, but with one really weird symptom. Do not fall for the trap. Trust the theme of the case. If 90% of the vignette is screaming a common diagnosis, do not change your answer because of one weird little detail that was put there specifically to make you second-guess yourself. Okay, let's bring it all home. We've just assembled a powerful 3-part toolkit. This isn't just designed to help you answer a few more questions. It's designed to fundamentally change how you approach the entire exam. And here it is, your complete board exam toolkit. You've got the analytical lens so you can decode data with confidence. You've got the clinical compass to slice through those long vignettes with strategy. And you've got the resilient mind to keep you cool, calm, and collected when the pressure is on. See, this isn't just a list of random tips, it's a complete system for success. But look, all this knowledge is only powerful if you actually put it into action. So as you head back to your studying, I want you to ask yourself this. What is the one strategy from this toolkit that you are going to start using tomorrow? Is it going to be the bottom-up approach for vignettes? Is it going to be focusing on that null hypothesis rule? Pick one and make it a conscious part of your very next set of practice questions. Start building that strategic muscle today.